Okay, it is recording. All right, so does everyone has the PowerPoints, right? So we can go ahead and start either on your computer or the printout versions. We're good? Okay, so we're gonna start with three because we have three chapters to cover, okay? So we're just gonna go in order. This chapter is a little, I don't know if you've heard it before. Do you guys remember your vitamins and minerals from nutrition? Not really? Not in depth?
If we come across them, I can. It'll probably spark the bug.
Okay. Well, this whole chapter is about vitamins and minerals. So hopefully it won't be too hard. It's just very common. Most of it's common knowledge, I would think, or isn't super complicated. So we're going to start here. All right. I'm going to share my screen and bring up the PowerPoint. Okay. So let me go ahead and do that. Um, okay. Let me see. Go away. All right. All right, we can all see it? Yes. Okay. Before we start, I also wanted to show you that I have this up. I went ahead and did this before class started. Can everybody see my quote unquote whiteboard? Okay. So I went ahead and did this because this is kind of like the summary gist material from this chapter. So we're going to go over some of these things, and then obviously a lot more because it's farm. But what is a vitamin? Let's start with that. What is a vitamin?
It's a supplement to
You
replace
can't,
someone.
yeah, you can take them as supplements. Yep. Yep.
It replace like different nutrients in our body.
Perfect. Yep. Because we do make them naturally, right? And then we can
Mhm.
also, yeah, eat them, right? So we do have both ways of getting them. But yet we can also supplement, and that's going to be what this chapter is going to be, is basically those supplements. Okay. Um, and then we have two different types of vitamins. Okay. Those are going to be my fat soluble vitamins. Have we heard of those before? Fat soluble?
Yes,
Okay. So those are going to be, I like to just remember them as CADE because technically that's a name. So it's easier to remember a name than just random letters. So vitamin K, A, D, and E. What does it mean to be fat soluble? Anybody know? Fats.
I was trying to unmute, but it's the ones that dissolve in the fat.
Yes, they do. They need fat to be absorbed, okay, and dissolved into. So if I don't have fat in my diet, can I really use them?
No.
No. Okay. So I need fat to be able to use these. Thank God I have a lot of fat in, the body, so a lot of adipose tissue. So at least we can do that. Also, these can be stored in the adipose tissue. So that's more beneficial as opposed to the water where you can't store them. Because that means that I may not have to intake as many because if I run out, I can use my stored up version. We go with that? Okay. And then my water soluble, I need water for them to absorb and to absolve. So dissolve. So I use these a lot faster in terms of how quick my body uses them because it's a lot faster to use water than it is to use fat. So again, because it's water, I also cannot store these. So do I need more of these ones in my diet? All the B vitamins and the C vitamins.
Yes.
Okay. Does everybody understand that? Okay. So just kind of the very basics there. Does everybody know what an antioxidant is? An antioxidant. What is that definition?
Do it get rid of the toxics?
It does. It gets rid of something toxic in my body called a free radical. which is kind of just like a lone charged molecule floating around my body that wants to cause inflammation and do damage and usually can cause cancer. Antioxidants help get rid of them. So the three vitamins that act as antioxidants, because there's other antioxidants in the body, but the three vitamins that act as them are my ACE, my A, C, and E. All right. So two of them are fat soluble, one of them is water soluble. All right, we good there?
Yes.
Okay.
Yeah, except for, I'm sorry, what did you say it gets rid of? You said pre-radical?
Free radicals. Yeah, like
Free.
free radicals.
Okay.
Yep. Yep.
Okay.
Yes, ma'am. And then we need vitamins to maintain homeostasis because I don't have them. Then I can't have my metabolism work. So what is metabolism?
It's what help your body burn fat
It is.
and
Yep,
break down. It's like a breakdown. It's like a mechanism that breaks down the
it
things in
is.
your body.
Yeah. So I teach my nutrition students about metabolism. That's where the definition starts. So basically I just say it's all the chemical reactions in the body. Okay. Metabolism is all the chemical reactions in the body and how they all interrelate to each other. How many chemical reactions do you think I have in my body? I don't have a number. I just want you to say high, low, high, very low. What are we looking at?
I would say high.
Very high. Okay. So metabolism is responsible for everything. And if vitamins help with that, are they pretty important? Absolutely.
Yes.
Okay. Yep. All right. So that is what we've got over here. Okay. So I'm going to go back to the PowerPoint. Okay. Um, so kind of just went through this. The two ways that metabolism works is it can either break things down in my body, which is catabolism, or it can break or build things up in my body, which is my anabolism. Okay. Questions or concerns about that? We good there? Have you kind of heard these words before? Yes.
Yes.
Sure. Maybe kind of sort of. Okay. So that is good to know. Okay. Also, what I was gonna say. Otherwise, if I don't have enough vitamins, I get a vitamin deficiency, which is why, again, like we were talking about in the beginning, this chapter is going to be okay. I don't have enough of them, so I'm going to take a supplement. Okay, so we're going to talk about the safety of those supplements and why we're taking them. Okay. All right. So we went through this, went through this, went through this. Okay. So we're going to start here. My vitamin A. Okay. So what does vitamin A do? All right. I start with the functions because I need to know how it helps with metabolism, how it's going to help my body, right? So the biggest thing that it does, okay, is that it's going to help with vision, especially the retina. Now we know the retina is very important, again, because of our, whole eye chapter. Okay. Without it, I can't see. So very important that I, take care of that. All right. It also helps build tissue and bone. Okay. And it also helps produce immune cells. Okay. Helps produce immune cells. Again, it is mainly stored in the liver and again, fat because it is a fat soluble. Okay. If I don't have enough vitamin A, all right, I get this condition right here. All right, this is the picture that your book provided. So here it is for you. You can almost see that she kind of has almost what looks like to be cataracts. However, this condition right here is that xerophthalmia. Okay, I don't know if you've ever heard of that. You don't really need to. I just want you to know that you can actually go blind from severe vitamin A deficiency. Okay. Or you could get xerosis, which is itching, burning, and inflammation of the eyelids in the eye. Okay. So either way, not enough vitamin A, gonna have some eye complications. Okay. Simple enough. So this is what we're gonna want to treat with a vitamin A supplement so that we don't get these things right here. Okay. Can I have toxicity of vitamin A, which means can I have too much of it in my body? Absolutely. Vitamins are still medicine. Okay. I can always have too much medicine. If I get toxic levels of vitamin A, the biggest thing that it's going to hurt is my liver, okay? And if I hurt my liver, we learned about cirrhosis in MedSurge 1, it is not a good thing, okay? Questions so far? Okay.
No.
No, okay. Also, there's a couple other, a few toxic things that can happen here. Just read through these, but again, the biggest one is going to be the liver, okay? So right here, all right, my indications for all of these medications are going to be I don't have enough, okay? So I'm not really going to spend a lot of time there. You're taking a vitamin because you don't have enough of it, okay? Or you want to not be in risk of not having enough of it, okay? Because we know some people take supplements before they're actually in deficiency mode, okay? Also, a contraindication, again, a forever contraindication is going to be my allergy. Remember I said that last week? Right on, right, right. Sure thing. Okay. All right. So another contraindication here is going to be if I have too much vitamin A in the body. If I have too much, it wouldn't make sense to take more of it, okay? Because then I would get those toxic levels.
I have a question.
Mm-hmm.
How do we go about, well, how will they go about finding out if you have too much vitamin A in the body?
Blood test.
Okay.
Mhm. Okay.
So you will have to show signs and symptoms of a vitamin A deficiency
Yes.
for them to, okay.
Yeah. Or they would have to say okay, what foods are you eating? Are you even taking a supplement? Or they can do blood levels, kind of get the whole picture. Okay. Good question. Any other questions, concerns? Any other questions, concerns? We good? Okay. My interactions, okay, is that I absorb less vitamin A if I use it with a laxative, okay? Especially the laxative cholestyramine, or it's also called Questrian. Okay, that's that little powder packet that looks like yellow. If you've ever given that and mixed that into a patient's drink, to help with diarrhea, okay? So basically it's the Questrian or it's the laxative, okay? If you take those with vitamin A, you are going to mess up the absorption of vitamin A and not get as much in my body, okay? And then my adverse effects, again, they're gonna look similar to that overdose or that toxicity that we were talking about. Okay, so kidney injury is definitely on here, okay? I might not have typed it on here, but it's definitely on the other slide, so still applies, okay? So basically, this isn't very common, but it can happen. So headache, increased intracranial pressure. What is my risk with that? Increased intracranial pressure.
Optic
It'll
nerve
be
damage.
It's what?
or a hemorrhage.
Yep, a brain hemorrhage. Yep. Or my brain cells can start to die. So very good. Thank you. So don't want that to happen. Okay. It can also make me fatigued. And then I get all my GI symptoms, nausea, vomiting, abdominal pain, a lack of appetite. Okay. And then I get dry skin, itching. Okay. Maybe pigmentation or skin color changes. And then it can affect my periods. Okay. Of growth. So if you're a child, maybe you won't grow as tall, things like that. But if we look back here, those are kind of what we saw with this section, okay? So the adverse effects that I'm seeing are going to be a little bit more of the lesser known toxicity effects. Does that make sense?
Can you repeat that again?
Yep. So the adverse effects I saw when I took a supplement are going to be similar to the toxic effects right here.
Okay.
Okay, we good? All right. Otherwise, that was vitamin A. Okay, so hopefully this isn't real hard here. If it is, let me know. I will stop for questions, obviously. Okay. Let me see. So the next thing that we're going to do is going to be vitamin D. Again, this is another fat-soluble vitamin. Okay. Vitamin D, its biggest job is to absorb calcium. Okay. Without vitamin D, I cannot let any calcium into my body, and then calcium cannot work. So is vitamin D important? Absolutely, because without it, I wouldn't have calcium. What is the biggest thing calcium does?
Bone.
Bones. Okay. So we're going to see that, right? Prevents osteoporosis. Okay. Needed for normal bone and teeth hardening. Okay. Enables calcium to be digested so that I can actually use it. And then we know that you can get it from food, and you can also get it from UV light, like from the sun. Okay. So if I don't have this, the biggest thing that I'm going to see as an issue is going to be my bones. Okay. So again, a deficiency is going to end in osteoporosis, or if you're a child, usually rickets. If you haven't heard of rickets, basically what it does is that it causes the bones to soften, and then the bones tend to like bow under the weight of the torso. Okay. So you can see that in the child right here. Her legs are bowed because she's not able to support the weight of, her upper body and her head. And then eventually the bones are going to break, fracture, all that kind of stuff. Okay. Which again comes from not having enough vitamin D and calcium. Okay. So osteoporosis, rickets, going to be your two biggest ones here. Okay. Osteoporosis up here. And then can I have too much vitamin D? Again, not really super common, but it can happen. All right. If it does, you're mostly at risk for kidney stones. Because what's the most common cause of kidney stones? Do we know?
Too much calcium.
Hypercalcemia.
Yeah, exactly. Too much calcium. Okay. Too much calcium. And if I have a lot of vitamin D, I'm going to be absorbing a lot more calcium. Do we see how that connects? Okay, perfect. Okay. So that's the generics of vitamin D. Okay, so now if we go into a vitamin D supplement, okay, obviously we're using it to treat a deficiency, or you can take more if you have issues like rickets or osteoporosis to kind of be a treatment for those issues. Okay. Like my mom has osteoporosis, she takes vitamin D supplements, she takes calcium supplements. She's not deficient, but it can help with the disease process. Okay. So either as a treatment for those or just if you're low. Okay. Otherwise, contraindications would be, again, we're going to see here too much calcium. Okay. Too much calcium. Because again, you bring in more vitamin D, those calcium levels are going to get even higher. Okay. And that's why we see renal dysfunction and kidney stones, again, with the high calcium levels. Okay. When it comes to interactions, all right. Again, like we saw with the A, you're not going to absorb as much vitamin D if you use it with a laxative or that equestrian powder. Okay. Simple enough. Okay. And then my adverse effects here, all right, are going to be hypertension, dysrhythmias, fatigue, weakness, drowsiness, headache, nausea, vomiting. Anorexia always means lack of appetite. Okay. Muscle cramps, dry mouth. And then now we have the bone stuff down here. Okay. Muscle pain, bone pain, and decreased bone growth. Okay. Most of these look like symptoms of hypokalemia. Okay. Or sorry, hypocalcemia. So most of these look like symptoms of low calcium. Does that make sense why those would be most of my adverse effects? Hypo or hypercalcemia. So any kind of calcium issue, you're going to see that as my adverse effects. Because if there's vitamin D connection, there's going to be a calcium connection with the adverse effects. Okay. Questions about that?
So you said these focus in on hypercalcemia, adverse effect, or low?
Both. So any type of immune response in the body can be messed up with altered vitamin D levels.
So is that why the adverse effects is hypertension or dysrhythmias because of the calcium? Did the
Yep,
calcium come affect the heart as well?
exactly. Yep,
Okay.
yep, yep. Because all electrolytes can affect any of my muscles or any of my nerves. Okay. We good there? Any other questions, concerns? I just want to make sure before we go on to the next slide. Okay. So the names of the vitamin D drugs, you probably have seen this one or this one. You know I'm horrible at pronouncing these. Calcifediol or calcitrol. Okay. This one probably is going to be the most common. Does that ring a bell to you guys? Yes. Okay. Sure. Okay. And we're done with vitamin D. Okay. As long as you remember that vitamin D is mostly connected to calcium, we are golden. Okay. All right. For
Miss
vitamin,
Hyde,
yeah,
will you be pointing out to us what we actually really need to know for the next test, or how do you want us to go about it? Just study everything?
um, so for each vitamin, I want you to know what it does. All right. You don't really have to know the indication because there's not enough of it. So I'm going to take a supplement. So that, as long as you know that, you're good for the chapter, basically. Okay. Um,
Okay.
and then I want you to know what happens when I don't have enough of that vitamin, when there's too much, and then any kind of like drug specific information like contraindication, interaction, or adverse effect. Okay. So
Okay.
like if you list all that for each one, you should be good. Okay.
Okay. Thank you for that. Thank you.
You are very welcome. You can just
Also,
summarize
I
it.
noticed that a lot of adverse effects, like from vitamin A and vitamin D, some of them are similar. So, are we paying attention to the ones that's like different? Because that's how I studied the last time. Because I was like, look, this is for everything, each
It
eye,
is.
okay? So I
Yeah,
focused in on the ones that was different. Is that a good way to go?
it is. Yes.
Okay.
Mhm. Yeah, definitely noting similarities and differences is a huge way to study. Okay. Good question. All right. But if you can, like I said, just summarize it for every vitamin, kind of like make yourself a chart, you probably would be better off. Okay. Just kind of write the main stuff. Okay. Vitamin E is an antioxidant. We know that that's my ACE, my A, C, and E. Okay. It also has immune functions, but the biggest thing that vitamin E does is prevent clots. Okay. It prevents clots in the cardiac arteries. So those would be my coronary arteries. Sound familiar? Okay. So if I don't have enough of them, okay, I am going to have issues. There's one that is the most important antioxidants. It's probably going to be E, okay, out of the vitamin ones, because we really see damage here from the free radicals. All right. And the issues that you're going to see are issues with the eyes and the spinal cord. So I want damage of my spinal cord. My eyes are one thing. My spinal cord controls everything. All right. It's the gateway of communication from my body to my brain. I don't want that connection to be lost. Okay. So definitely deficiency of this can be very dangerous as opposed to the other ones. Okay. Um, Also, it can lead to anemia. All right. So if you just know for deficiency, free radicals, spine and eye, and anemia, like you can just summarize it like that, right? If you're trying to like make a condensed list. Okay. And then toxicity. All right. If you have too much vitamin E, it can interfere with vitamin K. All right. Too much vitamin E can interfere with vitamin K. All right. And vitamin K, we don't want to mess with because that has to do with my clotting. Okay. And you can see why it would mess with vitamin K if it prevents clots when vitamin K creates clots. Okay. So if you have too much of either one, they kind of, are fighting for clot versus not clot. Okay. And then it also can cause anemia. All right. Which again, you get anemia kind of as a deficiency or as a toxicity. Okay.
I see that under there it say anemia for mostly infants.
Yes.
So that's where it'll cause anemia in mostly infants instead of adults.
You would see it more in infants, but you can still get it at any age. Yeah. So
Okay.
you don't need to focus on that. Yeah. Yeah. Good question. So why am I taking it? I'm not getting enough. Okay. Contraindication, there's just an allergy. So same as it always is. There's no interactions except with that vitamin K because that was on the last slide, right? So you don't only have to memorize that. And then my adverse effects, fatigue, headache, blurred vision, nausea, diarrhea, gas. So we have a lot of GI side effects here. Increased BUN and weakness. Okay. So like when you're studying, you can kind of summarize these as like GI issues. You know what I mean? So
Can
yes.
somebody tell us?
I'm sorry?
So the interactions, you said it's mostly with, it say none, but it can interact with vitamin K.
Yes, there is none, but when there's too much, it can cause interference with vitamin K. Only when there's too much though. Okay. So it's not like a true like normal interaction, but it can be more of like a function of vitamin E reaction. Does that make sense? Okay. And then increased BUN means what? As an adverse effect.
That they're going dehydrated.
Yeah, so you can see this with dehydration, but basically it means overall that you're having some kind of kidney irritation. And if you're not careful, it can lead to AKI. Okay, which you do see with dehydration. So yep. Okay. All right, vitamin K. Okay. Vitamin K is fat soluble. All right. As you can see, I'm doing all the fat solubles first, A, D, E, and K. Okay. So this would be the last fat soluble. All right. For this one, I'm going to go to this slide first. So the functions of vitamin K are clotting. Okay. They form my blood clots. Okay. There's two things that clot in my body. One is platelets, and one is the thing that vitamin K creates. Have you heard of fibrin?
Yeah.
Okay. So vitamin K helps create fibrin. So if I don't have vitamin K, I miss half of the clotting function in my body. Okay. Because again, it's platelets and it's fibrin, but I don't have fibrin if I don't have vitamin K. All right. So it's very important that I eat that in my diet so I have enough. Okay. It also can help with some bone development, but for the most part, it is clotting. Okay. Deficiencies don't really happen. The biggest population that has deficiencies are, like we say, neonates, because they get that vitamin K shots after they're born, okay, in the postpartum area. All right. Toxicity, again, there's not really like a high chance that you're going to have less of this or more of this. So it just that hopefully makes it easier. Okay. What is the one medication that has an issue with vitamin K?
War.
Warfarin. Yep. Coumadin, warfarin. Okay. Because vitamin K, to warfarin. Okay. So if you have warfarin, that's one time where you should not be intaking a lot of vitamin K. Okay. So just keep that in mind. I know you all hopefully are familiar with that. If not, hopefully that's makes sense. Okay. There's three types of vitamin K. There's K1, K2, and K3. I'm not going to have you know this slide. I just want you to be familiar. I'm just telling you that you may see different ones, but as long as you know that there's vitamin K and they're dark leafy vegetables, I think we're good. Sound good? Okay. Why I would give this again is the newborn injection, and then if I am deficient. Okay, that would be my reasons for giving this as a medication. Contraindications is just an allergy, which we always have. Interactions, there are none. Okay, unless it's the the warfarin reaction, which we talked about earlier. Okay. Sound good? But again, that's only an interaction if you're taking warfarin, and you just have to be careful. All right. Because it could alter your INR. Okay. And then my adverse effects here, I have headache, brain damage in large doses. All right. Brain damage. So you may see seizures, you may see encephalopathy, you may see cognitive issues. All right. So brain issues, probably one of the worst adverse effects here. Okay. Nausea is bad, but I don't really care too much about that. That's not going to kill you. Okay. Rash and hives, not going to kill you. Okay. So more of a mild adverse effect. Anemia is definitely a big deal. Okay. And then we have decreased liver enzymes. So anything that affects my liver enzymes, which are my AST and my ALT, will affect my liver function. Okay. And then what is hyperbilirubinemia? What does that do?
Jaundice.
Jaundice. Yep, that will cause jaundice. Okay. And that is definitely connected to the liver function issues here. Okay. Make sense? Okie dokie. And then the names of vitamin K are usually K1 and K3, like we talked about. I'm not going to require you to know these. Okay. But just be familiar with the fact that there's 3 different types, but I'm probably not going to test you on that. Okay. All right. We are going to move on here to the water soluble. Okay. So we're going to go to B and C, but as I said, all the B vitamins. So again, there are a lot of B vitamins. Okay. So I'm going to pick out the main things to you. I don't need you to know all of this. Okay. This is one of the rare times where I tell you, you don't need to know all of this. Okay. Take advantage of it. Okay. Doesn't happen very often. Okay. All
I
right.
think we getting that now.
Right. You're seeing how I teach, right? Okay. All right. Okay. So vitamin B1, or also called thiamine. Have we heard those put together before?
Yes.
Okay. So that's going to be our first B. All right. B1. All right. What it helps with is going to be metabolism. It's going to be the biggest thing, which we said are all the chemical reactions in the body. Okay. So big job here, especially with carbohydrates. Why is metabolism of carbohydrates so important? Metabolism of carbohydrates.
It turned into glucose.
Yep. Because without this, I don't have any energy for my cells and I'm kind of screwed. Okay. I can die. So pretty important to have vitamin B1. Okay. When they say that B vitamins give you energy, this is why. Okay. What is a B complex vitamin? I just want to clear that. What is like the difference between taking an individual B1 or a B complex?
All the B vitamins together.
Yes. Or several of them together. Maybe not all of them, but the most important ones. Okay. So just keep in mind that when it says vitamin B complex, you're getting several B vitamins together versus if you want to take each individual one by themselves. Okay. Just wanted to clarify that. All right. It also helps with peripheral nervous system. Okay. So that would be my, my PNS, all of my nerves in my body, which are pretty important to maintain. Okay. So, but all the B vitamins are really good with maintaining nerve health in different ways. Okay. So I definitely need these to maintain nerve health. So again, if I'm low on that, you're going to see that in some of the deficiency areas. Okay. Also helps with cardiac and GI tract. Okay. But the main thing that these B vitamins do is going to help with the metabolism and with nerves. Okay. Causes of deficiency. Again, why am I not having enough of them? Usually like malnutrition. I'm not eating enough of them. Usually it's a dietary issue. Okay. So I'm not super concerned about this. That's pretty common knowledge at this point. Okay. And then what happens when I don't have enough? Look what happens here. Loss of sensation in extremities. Loss of sensation in extremities. Could that have something to do with it maintaining the peripheral nervous system? If I don't have,
Yes.
okay. See, we're linking it, right? We're linking it, okay? All right. I know I'm dorky, whatever. All right. Um, okay. And then symptoms of heart failure. Okay. Because again, it helps maintain the cardiac function. Okay. So I don't have enough of it. Heart doesn't work as well. When the heart doesn't work as well, I get symptoms of, heart failure, which is edema or maybe some chest pain. Okay. So hopefully that is connected. Okay. And then we have some issues here with vision or memory loss, dizziness. Those are just some kind of random ones. All right. The memory loss also has to do with my, nerve function. Okay. We good here? And then for my reason again is I don't have enough of it, so I'm going to take a supplement. Okay. Otherwise, that's all I need to know about vitamin B1. Okay. All right. Vitamin B2. Okay. We've heard of it called riboflavin. I think I said that right. All right. Vitamin B2 is riboflavin. Okay. Again, indication is I don't have enough of it. Okay. This adverse effect I really don't care about because large doses turn my urine yellow. What color is your urine already? Yellow?
Yellow.
Yeah, not really concerning here, so don't really care. Okay. Um, and then cause of deficiency, again, we're going to see the same causes of deficiency over and over again. It's usually dietary, okay? If I don't have enough of this, okay, some skin issues here, some fatigue, blurred vision, depression. I do want you to pay attention here. Not enough B2 equals liver issues, okay? And reproductive issues. Hair loss, kind of important, but it's not going to kill me, so not my focus. Okay.
Can you repeat that, the one, because I think I was lost on the page.
Yep. So with vitamin B2 deficiency, the only ones I really need you to know is that it causes some fatigue, blurred vision, depression. Okay. That it causes liver issues and then reproductive issues. You can kind of disregard the rest. Okay. All right. And then what does B2 actually do? Okay. It is needed for normal respiratory function. Okay. Needed for normal respiratory function. You don't need to know this part down here. Okay. Just know I need it to breathe good. Okay. And just know that I need vitamin B2 to activate vitamin B6. Okay. That is a huge connection point. I need vitamin B2 to activate or for vitamin B6 to work because vitamin B6 is one of the more important Bs. Okay. Otherwise, we're pretty good with vitamin B2. Okay. Vitamin B3 or niacin. I'm just trying to think here. Yeah, I don't really care about this one, so you can just cross it off. Okay. All right. So vitamin B6, like I said, this is one of the most important ones, as well as the next one, which is vitamin B12. Okay. So 6 and 12, I know you're probably familiar with those ones or you've heard of them the most. Again, because those are going to be the most effective in my body. Okay. Vitamin B6 is called pyroxidine or pyridoxine. I don't know. I probably said that wrong in so many ways. But that is what it is called. Okay. So if you see that, that is my vitamin B6. You'll probably see it listed either way. Okay. This is the only water soluble vitamin that can be stored. Okay. So this is a very important fact right here. Because again, they're water soluble. There's no fat or anything like that that they get stored into. So vitamin B6 can be stored in the muscles. This is the very important fact because this is the only one that we store. Why? Because vitamin B6 is so important to my body. Okay. Simple enough? Okay. The functions of vitamin B6, why it's so important, is it plays an essential role with metabolism, especially all three macronutrients, proteins, fats, and carbohydrates. Okay. If I don't have those in my body's not working. Okay. So very important that I'm able to use those. Okay. It also keeps my brain healthy. This is one of the biggest B vitamins that will keep my brain healthy. Yeah, the other ones kept my peripheral nerves healthy, but if I don't have my brain, I don't really care if I have peripheral nerves. Okay. The brain is the most important thing in my body, my most important organ. Okay. So definitely needed to keep it healthy. Okay. Also, it's needed for hemopoietic systems. We're going to do that in the next chapter, but I'm going to tell you what hematopoiesis means now. Okay. So make sure you write this down. Hematopoiesis is the creation of white blood cells, red blood cells, and platelets in the bone marrow. All right. Hematopoiesis is the creation of white blood cells, red blood cells, and platelets in the bone marrow. Is that an important function? Abso-freaking-lutely. Okay. If I don't have those, I'm going to die. Okay. So do we see why vitamin B6 is so important? Okay. If I don't have enough vitamin B6, I'm going to have central nervous system issues. Okay. Because those are going to start to affect my brain health. Okay.
I have a
This,
question.
yes.
So these three, the white blood cells, the red blood cells, and the platelets, is the hemopoietic system.
Yep.
Okay.
Mm-hmm. Okay. Also, if I have a deficiency, I get the skin stuff and some anemia. Not as important as this one right here. Okay. If I have toxicity, I'm going to get neurotoxicity. Okay. So either way, if I have too much of this or I don't have enough of it, I'm going to have some sort of nervous system issue. Okay. Otherwise,
So
I,
what about the immune system? If we don't have enough, would our immune system be able to fight off any infection?
um, if you didn't have enough,
Because I see it's on here.
yeah. So if I didn't have enough, it would kind of affect that. It's not going to affect it in a huge way. However, it's going to more affect it due to the lack of the white blood cells.
Okay.
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 Yeah, good question.
Thanks.
Thank you. Yep. Thank you. All right. All right. Now for vitamin B12. Okay. We know we call this cyanococlib. I don't even know. You know the name for this. I'm not going to say it. Okay. Just know that that is vitamin B12. Okay. The major thing that this does is it's essential to DNA synthesis and cell division. Okay. So DNA controls my whole body. Vitamin B12 helps it work. Again, how it helps give me energy. Okay. How it helps my body function. Okay. It also helps with the growth of hemoglobin. Okay. If I don't have hemoglobin, there's not going to be any oxygen going around my body. Okay. If we did not know, hemoglobin is a protein in my red blood cell where that's how the blood transports my oxygen. Okay. I'm going to bring up my little whiteboard here. Okay. Basically, my red blood cell is a car. The blood vessel is the road, right? Because it's going somewhere. Okay. My hemoglobin are the car seats in the car. Okay. Oxygen needs to hop onto those car seats so it has somewhere to sit on its journey around the body. Okay. Then whatever cell it needs to get to, all right, the red blood cell stops, it's met its destination, and the oxygens hop out and go where they need to go. Okay. So without hemoglobin, am I screwed? Without this bad guy right here, no oxygen is going to go into my red blood cell because it doesn't have anywhere to sit. It's mad. It's like, you don't care about me. You're not going to help me travel safely. I'm not going anywhere. Okay. It's very diva-ish of the oxygen, but without hemoglobin, it's not going where it needs to go. Okay? Questions about this? Okay. Also, vitamin B12 helps maintain hematopoiesis, which again is that creation of the red blood cells, white blood cells, and platelets in my bone marrow. Okay? So both B6 and B12 do that. Okay? A deficiency is going to cause pernicious anemia. Okay? We've heard of this, right? Pernicious anemia is an autoimmune disease where the body attacks the way that the body uses vitamin B12, and I don't have enough of it. Okay. Also, it's going to cause nerve damage, okay, and brain damage if I don't have enough of it. Plus fatigue, anorexia, and nausea. Okay, those are the big ones I want you to know. Okay. Toxic levels, not really a concern here. Okay.
So not digesting issues, just the
It does, I
first
just don't want you to know that.
four.
It's not the main one.
Okay, so just the first three, you
Correct.
said, right?
Yep,
Okay.
you're correct. That's one of the ones you can cross off. Okay. All right, so we're gonna go to vitamin C, which is my last vitamin here. Okay. So vitamin C is called absorbic acid. We've seen that before, right? Okay. So when you see absorbic acid, that means vitamin C. The functions of vitamin C, one, it's a antioxidant. Okay. We know that it has a huge immune function, which is why when they're sick, they say take vitamin C. Okay. Also, it helps repair tissues. So again, when you're sick, repairing your tissues is not going to hurt you. Okay. Also, it enhances the absorption of iron. Okay. It enhances the absorption of iron. So if you're taking iron pills and you drink orange juice, that's going to help you get that that iron, pill in you better. Okay. It's going to help with the digestion. Okay. Deficiencies right here. These are all symptoms of what I have down here, which is scurvy. Okay. Scurvy is what the disease is called when you have a deficiency in vitamin C. Okay. So these are going to be the symptoms that you see. Okay. A lot of bleeding, a lot of joint pain. Okay. Skin discolorations and broken bones. Okay. So vitamin C, as well as its immune functions, very important to the health of a lot of other things. Okay. If I have too much of it, I'm at risk for kidney stones. Okay. Also, nausea, vomiting, headache, nothing kind of crazy there. Okay. Why I take it, again, I need to treat scurvy. I have a deficiency. Okay. Contraindications is if you take this with antibiotics, you may affect the absorption of the antibiotics. Okay. So the antibiotics may not be used as well. Yes.
I have a question. So
Yes.
you said the deficiency can cause scurvy. The
Yep.
toxicity, I'm seeing that quick discontinuation can cause scurvy, but you're
Yes.
treating this, you taking this to treat scurvy.
Yeah. So basically, if you deprive your body of vitamin C quickly, like
Hmm.
kind of like shock absorb it, like, hey, I'm taking away all your vitamin C, you're going to put your body into a very quick deficiency of scurvy. Okay.
Okay.
So then you would need to fix it by giving it back, which would treat it. Okay.
Okay.
Okay. Yep. Okay. And then my interactions, like I said, if you're taking antibiotics, may not work as well. Okay. Also, if I'm taking benzodiazepines like Xanax, Ativan, okay, anesthetics like my general anesthesia, things that are going to put me to sleep like propofol, okay, or morphine, okay, it can enhance the excretion of these medications. So that means they're going to come out of my body a lot faster than they should, okay? So they're not going to be as effective for as long, okay? Does that make sense? Okay. And then I have delayed excretion of barbiturates and aspirin, okay? So that means that these medications are going to be in my body longer, which means I have a risk for toxicity of them. Okay. And I don't know if you remember from last semester, but barbiturates are seizure medications as well as anesthesia medications. So having a lot of this in my body can hurt my brain, can put my body into severe like respiratory depression, coma. Okay. So this is not a good thing here. All right. Sound good? Okay. All right. We're gonna go to minerals. Okay. Um, I want to bring you back to my little board over here. Okay. Why are minerals important? Okay. Because they are electrolytes. Not all minerals, but what we consider electrolytes in my body are the minerals. Okay. Potassium, calcium, magnesium, sodium, what are the chloride, right? Those are all minerals. Okay. So very important. And I also need them to regulate my body's metabolism. Okay. So you can see the metabolism here on vitamins and minerals. Okay. We go with that. Okay. So I'm not going to go over these too much. I'm going to have you read through more of these because I have a lot more material to get through. But if you are pretty much familiar with my electrolytes. Yes.
You said your electric light, like the ones
No,
we went
are
out.
you yeah, like are you familiar with like the main four? Sodium, potassium, calcium,
Oh
and magnesium.
yes.
Okay. So if I just have you read through these ones, are the main four, are you going to be okay? Yes.
Is there
Yeah, if
something
I was
like
gonna say that.
I'm sorry, it just
The
echoed.
same, is it gonna be the same things that you said you were looking for as far as the previous slides? Like what toxicity looks like, what
Yeah. So what does it do?
what it does.
Yes. So what does it do? All right. What's going to happen when I don't have enough of it? All right. That's pretty much it. Like, what is a high? Sorry, my dog was barking. I'm sorry. Um, Bella! So what do I do if I don't have enough of it? What happens when I have too much of it? Okay. Kind of what does that electrolyte do? If you know those three things, I think we should be good. Sound good?
yeah.
Okay. I'm just gonna go over the ones that we're not as familiar with. Okay. Um, so phosphorus is also an electrolyte. Okay. It has an inverse relationship with calcium. So what does that mean by inverse?
They do the opposite.
They they don't necessarily do the opposite, but it means that there's like a teeter-totter effect as to how much is in the body. So if there's low or high
Gotcha.
levels of calcium in the body, there's going to be low levels of phosphorus and vice versa. So they're opposites in terms of like how like amounts in the body. Does that make sense?
Yeah, so yeah, like opposites as far as what's going on with it, right?
Yeah, in
Like
terms
if
of
one is
amount.
high,
Yeah.
one will be low.
Yeah, exactly. Yes. Okay. I just didn't want you to think that they would be opposites in terms of their functioning, but just in terms of amounts. Okay.
Okay, thank you.
Okay. Perfect. Thank you. All right. So phosphorus is responsible for bone and teeth formation. All right. You're going to see a lot of similarities with calcium since it does work very closely with it. Okay. Also needed for metabolism, like we've been talking about. Okay. Needed for RNA and DNA, which is essential to life. Okay. Helps with acid-base balance, so like my ABGs, okay? And then helps with brain and nervous system health, okay? If I don't have enough of this, all right, I'm gonna get more like, obviously the reasons I don't have enough are gonna be I'm not ingesting, okay? Or it could be I have high levels of calcium, okay? Toxicity of this doesn't happen very often, okay? But it usually leads to osteoporosis or it could lead to difficulty breathing. Those are the two I really want you to know. Okay. Um, when the last one we're gonna do here is zinc. Okay. Um, Zinc helps break down or helps with my metabolism of all my macronutrients, so my fats, carbohydrates, and proteins. Without this, I would die. Okay. So very important function here. And then also helps with RNA and DNA and enzymes. So again, similar functions, RNA, DNA, helps with my metabolism. All right. So hopefully, phosphorus and zinc aren't that different in terms of functions that you need to know. Okay. Without enough zinc, I have stunted growth, delayed wound healing, and am immunocompromised. Okay. That's all I need you to know from that list. Okay. And then if I have toxic levels, it alters my white blood cell function. So I have white blood cells, they just might not work the way that they should. Okay. And then for all of this, for my nursing implications, okay, I basically need you to know your patient's baseline labs, okay, because a lot of these affect normal organ systems, okay. And I also, if we're giving these levels, we may need to know what the patient is taking, how much is in their body. Okay. I also need you to do a respiratory assessment because if there's not enough, like maybe of what they're intaking, then that needs to be addressed in terms of what are they eating, what are they not eating. Okay. Is there a malnourishment issue? Okay. And then we're probably going to need to consult a dietitian. Okay.
Can you zoom out on that? Can I take a picture of that or not?
Yes, let me zoom out. Oh, that was way too far. Otherwise, I think this is the next one in, so I'm sorry. This is the best that will zoom out. Okay. So you can
Okay.
definitely go ahead and take a picture of that. It'll also be in
All
the
right, thanks. Yeah.
okay. All right. Any questions or concerns about 53? Okay. So I'm gonna give you a short break. All right. Come back at 7. Come back at 8 o'clock, take 10 minutes, okay? And then we'll spend the last hour going through the last 2 chapters, okay? All right.
Okay.
Okay, thank you. Okay. Um, so we are going to start again. All right. I'm going to share my screen. We're going to do chapter 54. Okay. All right. So I first want to bring you again to a new page of this. Okay. So the thing I want to focus on first is going to be, again, that definition that we just said in the last chapter, my hematopoiesis. Okay. Hematopoiesis is the bone marrow creating white blood cells, red blood cells, and platelets. Okay. Because that's one of the main functions of bone marrow inside bones. Okay. And then we have the definition right here. Erythropoietin, okay? Erythropoietin, that is a hormone from the kidneys that tells the bone marrow to make more red blood cells, okay? So when I do not have enough red blood cells, like when I have anemia, all right, the hormones will say, hey, I know we need more from the kidneys. So the kidneys will then send the message to the factory that makes them saying, hey, we need more, make more. Okay. Any questions about that? Okay. So again, hematopoiesis is the creation of all three. Okay. Erythropoietin is the messenger from the kidney that detects like, hey, not enough red blood cells in this blood. Okay. Then the message goes and tells the bone marrow, hey, you need to make more. Bone marrow will then make more. Okay. Simple enough? Okay. And then what's the definition of anemia? Simply just not enough red blood cells, right? Okay. Does anybody know why we don't get enough red blood cells?
Is it a deficiency?
Okay, yep, could be a deficiency. So there's usually three reasons. One, I lost it. Okay, like I'm hemorrhaging, I'm losing blood. Okay. Two, I'm not making enough of it. Or three, what I have is being destroyed.
Right.
Does that make sense? So can someone summarize that for me?
Hypovolemic.
Wait, what?
Like
Yeah.
if you
No,
was
just
hypovolemic,
yes, hypovolemic. Yep. Okay. And then what else? I'm
or
not.
would it
Hyperplasia.
affect sickle cell wasn't affected with it?
Yep. Sickle cell would be
Yeah.
under the guise of they're being destroyed. Okay. Yep. And then I'll go over some examples where they're not, my body is just simply not making enough. Okay. Any questions about what I have up on here? You good? Okay. Let me go to the PowerPoint. All right. So we're gonna start here at the beginning. So again, I just told you what hematopoiesis is, right? So we're good there. Okay. And then anemia, we literally just said that that is the loss or not enough of what red blood cells, just simply plainly like that. Okay. Usually it's anything below 12. Okay. Anything below the level of 12 for hemoglobin. Okay. Because what does low hemoglobin tell me?
You don't have enough oxygen in your red blood cells.
Yeah, yeah. But basically, yeah, I don't have enough red blood cells, right? As
Same
well as I can
thing.
look at my red blood cell level. Simple enough? Okay. What are some of the symptoms if I don't have enough red blood cells? What are usually like the symptoms of anemia?
Tail.
Pale?
Cold,
Cold?
fatigue.
Fatigue.
No, it's not.
Confused.
Yeah, perfect. Yeah, fatigue, weakness, dizziness, cold. Okay.
What is that one name when you eating unusual things like starch and ice?
That's anemia.
No, you're thinking of pica.
Pica. That's what it is.
Oh,
Pica.
yes, yes. Yeah. You may have that here, but that's more of a rare cause for anemia. Okay. All right. So when I'm treating anemia, the biggest thing I can do is treat the cause. Okay. So if I know why it's happening, I can kind of stop that cause. That would be the first and foremost thing I want to do. All right. The next thing I can do is simply replace your blood. Okay. Or give you an iron transfusion. Okay. Sometimes you need them together. All right. And then I'm going to talk about some other medications we can give in a second. Okay. Here is just a picture of your blood with anemia. Okay, you can obviously see that there's less red blood cells than with everything else. Okay. And then we talked about the symptoms, so I think we're good here. Just be aware that you can also get shortness of breath. You may get some, eye or some like body color difference. We kind of talked about the pale color. All right, but my skin may also turn yellowish. All right, my stool may also change colors. Okay, but those are more rare ones that you don't really see too often. Okay.
What point do we have to get to a certain point for it to cause a heart attack?
Yes.
Okay.
That would be more from lack of blood, basically, just as a whole. Okay. Yeah, thank you. Yeah, perfect. Okay, so these were some of the causes I was talking about. Again, the three main categories, I don't have enough, so hypovolemia, okay? Either I'm hemorrhaging out blood, I don't have enough fluid, okay? Trauma, we go with that one. That one's pretty, I think, clear, cut, and dry, okay? We have decreased production, okay? So again, this is where my body is not making enough, okay? So it's not the fact that I don't want enough, my body just isn't doing it, okay? So this would be like where that pernicious anemia comes in that we talked about, okay? You may have chronic diseases, okay, like maybe the kidney, can't, if I have chronic kidney disease, do you think it's going to be able to make that erythropoietin hormone? No. And if it can't make that, then it can't tell the bone marrow to make more of it, so I may not be making enough. Does that make sense how that connects? Okay. And then last thing, I may have aplastic anemia. Maybe you've heard of this type right here. Okay, but that's very, very rare. It doesn't happen very often. Okay, but that's where the bone marrow just stops making new blood cells entirely. So basically, the bone marrow just kind of like says, I'm on strike, I'm not doing it, something's wrong, okay, with the bone marrow. All right, and it's not doing its functions. Okay. Um, am I breaking up or am I back? We're good. Okay. All right. And then I have issues where I have hemolytic anemia. Have you heard of hemolytic? Hemo meaning blood, lytic meaning like break or slice through, right? So like I said, sickle cell anemia is a version of that because what happens to my cell when I have my red blood cell when I have sickle cell anemia?
It don't have oxygen.
It doesn't, it's not really able to carry as much oxygen, but it basically goes like this. My nice and healthy circular red blood cell is altered to look like
A moon shape.
a moon shape, a crescent. Okay. So this doesn't have enough room to have hemoglobin and oxygen, right? Plus, if you have a lot of these in a blood vessel, they're going to clump, causing like a blood clot, or it's actually going to block other blood flow. Okay. So all in all, sickle cell, not good because of that. We go with this? Okay. All right. And then there's also genetic conditions that may, destroy your red blood cells and things like that. Okay. Another huge cause of anemia could be dietary. Okay, so you may not be eating enough iron, or you may have, you're not eating enough like protein, things like that, like red meat. Does that make sense? Okay. Otherwise, I think we're good. Those are all the things about anemia I wanted you to be aware of. Any questions, concerns? Okay. Um, so we're going to talk about the first drug here, okay, to help with anemia. So we said blood transfusions, iron transfusions. But if you don't want to do those, okay, we could give you an erythropoiesis stimulating drug, okay?
Okay, you're going out now.
Cells in platelets. But can I choose to focus on only one out of the three? Whoa, sorry. It's just completely crept
Can
out
you
on me.
go back because when you
Yeah,
gave us the name
sorry.
of the drug, you just went blank. It
Okay.
froze.
Yeah, let me go back. Give me 1 second. This was just crapped out of me. Okay. Let me go back. So, I haven't gotten to the drug name yet. I was just asking because the class of drug is erythropoiesis stimulating drug. Okay. So I want to define what erythropoiesis means. Okay. So if I go back to here, hematopoiesis means the creation of white blood cells, red blood cells, and platelets. Okay. So that's kind of like a plural version. Can I focus on one versus the other? Like, what if I just want my bone marrow to make white blood cells, or I just want my bone marrow to make red blood cells? Can I do that?
Yes.
Yeah. Okay. So the process of me just making my red blood cells is going to be called erythro. Well, if I can spell, that would be great. Erythropoiesis. Okay. I'm still not spelling that right. Sorry. Erythropoiesis. All right. So this is going to be the creation of just the red blood cells. Okay. Are we good with that? Because it might be important for me to just pick one depending on what issue I'm treating, right?
Mhm.
Okay. So when I go back to this slide right here, these drugs are just going to tell the bone marrow to produce red blood cells. Does this make sense? Okay. That's why it's erythropoiesis stimulating, right? We're trying to create just erythropoiesis. Okay. So hopefully any questions there? Okay. The name of this drug is epoetin alpha. Who's heard of that bad guy here? Okay. Maybe a few of you usually get it as an injection. Okay. Might have seen like this name more right here. Okay. RNS, Necept, however you want to say this.
Don't a lot of dialysis patients get it?
They do work on dialysis patients. You are 100% correct. Okay. And those are probably going to be the patients that use these the most. Okay. And that brings me to my next point. Okay. Who uses these? Usually dialysis or chronic kidney disease patients or cancer patients. Okay. Okay. Because if I'm getting chemotherapy, is that going to hurt my bone marrow? Yeah, absolutely. Okay. Which is going to hurt the production of my red blood cells, right? Okay. And if I'm having kidney disease, how is that going to hurt the production of my red blood cells?
The
Kidney disease.
kidneys have a hormone that,
Yeah.
sorry, the echo is crazy.
Yeah, no, but yeah, I got your point. We're good. So yeah, we're not going to get that erythropoietin hormone to send the message, right? Okay. So do we understand my two biggest reasons for using this injection? A-okay. Yes? Questions?
So when you giving this injection, it just telling the bone marrow to make it.
Yep, so that's going to be my next one. How does this work? It's going
Okay.
to be a fake version of that erythropoietin hormone. Okay. So yes, you are basically correct. I am going to give you more of that hormone. Okay. Because it's basically going to go to my bone marrow and say, hey, I need more of this. Make it. Okay. That's what my drug is doing. Okay. Mechanism of action makes sense? Okay. However, this medication will not work if my body does not have enough iron. Sorry, question?
Can you repeat that?
Yep. So it basically is causing an artificial, like I'm giving you an artificial version of that erythropoietin hormone that tells the bone marrow to make more red blood cells. Okay. So that's how it's working.
Can you repeat about the kidneys?
Yep. The kidneys make that hormone. So the kidneys make this erythropoietin hormone. So if the kidneys are damaged, like with my dialysis patients, okay, they're not going to make this hormone and they're not going to be able to tell the bone marrow to make more red blood cells. So I'm not going to have enough. Okay, so they will need this medication for that reason. Make sense? Okay. However, this medication will not work if I don't have enough iron in my body. Okay. So if I have low iron stores and I'm taking this medication, I may need an iron infusion. Okay. To kind of boost that up so the medication can work correctly. All right. Everybody good so far?
Do you want to know the longer acting form of it?
Be familiar with the name, but I'm just going to quiz you on
Can
this
you hear
name.
me?
Yep. You should be familiar with this name, but I'm only going to quiz you on epoetin alpha. Okay.
Mhm.
All right. So what are reasons why I shouldn't say? I have uncontrolled hypertension. Okay, so I have high blood pressure that's not being treated very well. Okay. I have a risk of a stroke, or I've had prior issues with strokes like clots, DVTs, pulmonary embolism, strokes, heart attacks. Okay. I have head and neck cancer because for some reason, this drug and that type of cancer just makes that type of cancer worse. Okay. It's just something weird they noticed. Okay. And then if I am a cancer patient, okay, my hemoglobin level should not be higher than 10. Okay. My hemoglobin should not be higher than 10. If I am a kidney patient, a dialysis patient, the hemoglobin should not be higher than 11. Okay. If those are the reasons you're taking it and your hemoglobin is too high, you will put your patient at a higher risk for clotting. Okay. Their bodies can't handle higher hemoglobin levels than that working with this drug because they're so sick. Okay. Simple enough? Okay. My adverse effects here are going to be hypertension, which makes sense why that's a contraindication, right? If I have high blood pressure issues, do I want to give you a drug that could make it worse? Absolutely not. Okay. Fever. All right. Headache, itching rash, nausea, vomiting, joint pain. And again, this is an injection, so redness, swelling at the site of injection. Okay. Why would fever be concerning here as an adverse effect?
Because you're messing with the bone marrow. It's something
Exactly.
that's affecting the bone marrow.
Exactly. My biggest fear for this is with cancer patients because they're already immunocompromised, correct?
Hmm.
Okay, so if they have a fever from this medication, it's just a random fever. It's not connected to anything because it's from the drug, right? However, how do I know with that sick patient without an immune system if that fever is from the drug or if that fever is from an infection?
Would your lab show it?
You would have to look at the labs and you would have to check for sources of infection. Okay. But could this be a problem with someone that's immunocompromised? Absolutely. Okay. So do we see the issue here? Okay. Other than that, like I said, make sure you know their iron levels and their hemoglobin levels. Okay. Any questions about EPOE and alpha? Okay. Um, we're going to do iron next. Iron is we can supplement that. You don't have enough of it in your body. I'm simply going to give you a pill, an injection, whatever form you need. Okay. Iron is essential for making hemoglobin. Okay. Which we already talked about why we need that. So we good? Okay. Reasons I need to take this, I have anemia or I'm low on iron. Okay. Or I need more hemoglobin. So low levels of, red blood cells, low levels of red blood cells, things like that. Okay. What this does is I'm literally like replacing the iron in your body, just like the vitamins and the minerals. I'm literally giving you back what you don't have. So that's basically all it is. Okay. I'm supplementing it. Okay. So it's nothing more complicated than that. Okay. What are the health benefits of getting iron? Again, it's going to treat your anemia, okay? It's going to improve your circulation, okay? And boost your hemoglobin, which you need to survive. So pretty beneficial with that, okay? All right, my contraindications here, why I should not take iron supplements, okay, is always an allergy or 1 or 2 if I have too much iron in my body already, okay? If I have too much iron already, it isn't going to be helpful to give me more, okay? Or if I have hemolytic anemia, okay? Because if I have hemolytic anemia giving you iron, I'm just going to give it to you and my body's just going to break it down before it can even be useful, okay? So it's just kind of counterintuitive. Make sense? Okay. Interactions. I told you that vitamin C helps absorb iron. Okay, so we're seeing that again here. Okay, orange juice or absorbic acid. Those are the only ones I need you to know there. Good? Okay. And then things can help impair iron absorption would be eggs, corn, beans, or cereal. Okay, so just make sure you're familiar with that list. All right. Otherwise, there's no interactions that you really need to know about. What can happen if I have iron? Can I have iron poisoning? Absolutely. So let me tell you what you do with iron poisoning. Okay. It goes in stages of severity. Okay. You can see that the very last stage, okay, it can cause GI obstruction, all right, um, lung failure, coma, seizures, liver failure, okay, or you can go into shock. So again, not good stuff happening here. Simple enough. Okay. How do I treat this? I can give you this drug right here. All right. I'm not going to even try to pronounce this drug, but you should be familiar with the name. Okay. These two D starting medication names. Those are going to help with the iron toxicity as well as like chelation therapy and stomach pumping. Okay. Sound good?
So is it a certain stage that you want us to focus in on?
No, I just want you to kind of just
Just be
be
familiar
familiar.
with it?
Yeah.
Okay.
Yep. Okay. All right. And then I do need you to be familiar with the treatment. Okay. I do need you to like make sure you know the treatment. Okay. All right. Um, Other than the poisoning, okay, who's more at risk of poisoning? Usually kids, okay. But it could happen to anybody. All right. If you are taking oral iron, you need to take it with a straw. Okay, because if you just, drink it normally, it will stain your teeth permanently. Okay. Also, it causes injection pain if you're getting it from an injection. And then we know that there's a lot of GI issues that come with this, right? Upset stomach, constipation. It can turn your stools black and tarry. Okay. The patient needs to be aware that when they see black and tarry stools, this does not mean that you're having blood in your stool. Okay. All right. Otherwise, we need to make sure that we know the different versions here. I'm going to tell you which ones I want you to know. Okay. Um, so for the oral form, so what you can take by mouth, all right, that is going to be the biggest ones are going to be your ferrous glutamate and your ferrous sulfate. Simple enough. Okay. And then obviously these ones are going to be the ones that cause the more GI issues. Okay. Because they have to go through the GI tract. And then I have my injections, mostly my iron dextran, my ferric gluconate. Okay. I want you to know those two. We good? Okay. Otherwise, we're done with iron. Questions, concerns? Okay. Folic acid is a type of B vitamin. It is vitamin B9. Okay, so I put that up here. All right, it is vitamin B9. Okay, so it is considered a B vitamin. Okay. Why is that important? Because my B vitamins helped with neuro health, right? Okay. My B vitamins helped with DNA. My B vitamins helped with hemoglobin. So you're literally going to see all of that right here in its functions. Simple enough? Okay. Also, we know that you need to take it when you're pregnant so your baby doesn't get spina bifida. Okay. All right. Otherwise, why are you taking this? Because you're pregnant or because you have a deficiency. Okay. Mechanism of action, I'm literally just replacing it. It's a supplement. Okay. Doesn't get any more complicated than that. Okay. Contraindications. You should only treat this if you know why you have a folic acid deficiency. We shouldn't just be throwing folic acid at you. Okay. So I need to know why. Is this actually like a folic acid issue or should I be giving you something else? Okay. My interactions. If I take this with oral contraceptives, so any type of oral birth control, steroids, so any kind of like prednisone, okay? If I take this with this particular type of antibiotic, my sulfonamide antibiotics, which if you remember are the ones that cause the sulfa allergy, okay? With cancer medications or methotrexate, okay? the folic acid to not be absorbed, and it will basically make it less effective. Okay, it's going to make it not get absorbed into the body, and I'm not going to have very much of it. Okay, simple enough. All right. Adverse effects here are rare. You could get an allergic reaction. Again, yellow coloration of urine. Urine's already yellow. I don't really care. Okay. Something that I have to make clear though, I'm going to go back to my little board here. All right. Is that when I have folic acid deficiency, all right, it can also look like vitamin B12 deficiency. Why? Because what is folic acid?
B9.
E9. Okay. So these deficiencies look almost identical. Okay. So you can mistake one deficiency for another. Okay. It's very easy to mistake one deficiency for another because the signs and the symptoms are the same. Okay. Does this make sense? The only thing is that I know they both do nerve health. However, vitamin B12 is going to be the bigger nerve player on the board here. So when I have vitamin B12 deficiency, I'm going to tend to see more nerve issues like neurotoxicity, seizures, nerve pain, okay, than I would with the B9, okay? Does that make sense so far? Otherwise, symptoms look very, very similar, okay? Yes,
So that's how you'll be able to tell the difference between the two.
you could. You could. Or the best way to tell is a blood test, okay? Before you treat this, you need to get that blood test, all right? And I'm going to tell you why, all right? Because if you go by symptoms alone, this may or may not be evident to you, okay? So you need that blood test because if I don't get that blood test and I think that it is a folic acid deficiency and I give you folic acid, but it's actually a vitamin B12 deficiency and you let this deficiency keep going, right? Because if I give you folic acid instead of vitamin B12, am I really fixing the real deficiency? No, I may be covering up the symptoms. And then the thing that's going to go without help is going to be my nerves, and I could get permanent nerve damage. Okay. Does this make sense? So moral of the story, when I think I have either one, I need to get a blood draw to make sure, because if I misdiagnose just based on symptoms and I give you folic acid and it's really vitamin B12, this nerve issue is going to get worse. Yes. Questions, concerns?
So before giving either medication, I'm going to get the blood test and then I will see which one to treat because I don't want to be treating one and it's the other cause.
Correct.
Okay.
Because the time that gets dangerous is with the vitamin B12 because of the such strong nerve function that it has. Okay. Does anybody have any other questions about this? Okay, so what's the moral of the story here? Get your blood test. Yep, and get that accurate diagnosis. I need my diagnosis to be 100% correct. Okay, because they do look the same. Okay. Are we good here? Okay. All right. So that is all written out for you right here as well. Okay. All right, we're going to skip vitamin B12 because we just did that in the other chapter. Okay. Otherwise, just read through the nursing implications and we are good. Questions or concerns about 50 or 54? Any questions before we move on? No?
No.
Okay. All right, I'm going to move on to 55. This one's very short, so we are almost done. Okay. All right. So when we go to 55, okay, these are nutritional supplements. So these are more, I'm basically going to tell you tube feeds. Okay. We're going to go over different types of tube feeds. All right. So it's not anything crazy. There's 16 slides. We're not even going to look at all of them. Okay. So why are nutrients so important in my body? Because they do all of this stuff right here. Are those important things? All right. Cell growth and division. My body's constantly doing that my whole entire life until I die. Okay. Enzymes break things down. Without that, I wouldn't have metabolism. Muscle contractions run my whole body. Okay. If they're not skeletal muscles, they are smooth muscles doing that. Okay. Hormones. What is a hormone? I want to make sure we know what that definition is. What is a hormone?
A chemical that's released when needed.
It is released when needed. And what does that chemical do? I need more.
Turns on and off different receptors that it goes on to, or
Yes, yeah, no, you're right. Yeah, you're right. So a hormone, if I had to give you the definition, you're correct. All right, a hormone is basically a chemical messenger in the body. Okay. A hormone is a chemical messenger in the body. And usually, what is the message that it is sending? That message is saying, yes, turn something on or off. Right? So basically, it's telling organs, do this, don't do your function, or do your function. Okay. What's the biggest example of that? Like maybe like estrogen. Or sorry, go ahead.
prolactin,
Could be prolactin. What's that one do?
breastfeeding.
Yep.
Well,
No, you're right. If I needed to start breastfeeding, then that would turn on my breast to produce milk, right? Okay. Makes sense? All right. Another example would be if I want my thyroid to work, I need thyroid stimulating hormone to come tell my thyroid, hey, it's time to work. Okay. Simple enough? Okay. So this is a huge function, right? This is how I control my body. What is the other way that I control my body? I control my body through hormones. And I control my body through what else? What's the other thing?
Is it nerves?
Yep, nerves. These are the two biggest things that will control my body, my hormones and my nerves. So having control of my hormones and those functioning correctly is very important, right? Do you think my body can function without them? No.
No, because your body won't have no communication with each other.
Exactly, right? If it's not communicating, there's no regulation. It's just going to do nothing or it's going to go crazy. Okay. Make sense? Okay. Questions here. Is having this little board thing helpful? Okay. Okay. All right. So again, very important functions here. And I just want to summarize the main need for nutrition is what? The main goal of nutrition is
fuel
to
the
maintain what?
Cell growth.
Maintain homeostasis.
Yep, that big word, right? Okay. This is always our goal. Okay. The main goal of nutrition is to maintain homeostasis. Okay. Simple enough. Do you think that you may see this bad boy again? Oh, yeah. Okay. We good here? I don't give you a study guide, but I tell you crap that's important. Okay. All right. Okay. There we go. All right. So why do I need nutritional supplements? I don't have good nutrition, right? Something's happening that is causing me to not be able to intake good nutrition. So what would some of those issues be? Tell me some.
Malnutrition.
Malnutrition. Like what causes malnutrition?
The body. mm, Yeah, right. The body.
Well, it could be absorption, like something wrong with my GI tract, right? I'm obviously maybe I'm not intaking enough. Maybe I'm an alcoholic and I'm drinking more than I'm eating. Make sense?
Would anorexia be one?
Anorexia
Like
would
the
be one.
disorder itself? Okay.
Yep, you are correct. All
Physical
right.
activity, weight.
So we're going to talk about a couple different supplemental nutritions here. What is the difference between enteral and parenteral? Enteral,
Enteral is by the gastrointestinal,
sorry,
and
say that one more time.
parenteral is intravenous.
Yes. Okay. Yeah. Thank you. Enteral goes into the GI tract. All right. Parenteral goes into the bloodstream. Okay. Usually through some type of injection. Okay. We go with the difference there. Okay. Make sure that
Mhm.
you are definitely aware of this. Okay. All right. So going back, okay. We're gonna go through some enteral tube feeds right now. Okay. So again, nothing crazy here, just basically what you would put through an NG tube or a PEG tube. Okay. Or like maybe like a boost or an inshore type thing. Okay. Um, so why do I want to give it? To enhance nutrition, obviously. Okay, nothing crazy there. What is it doing? Is providing me with my macronutrients. What are my macronutrients? It's providing me with my core. All right, my core macros. What are my macronutrients?
Oh,
Carbohydrates.
Like protein, carbs,
Yep.
fats.
Yep. You just listed all three of them. Protein, fat, carbohydrates. Okay. We good there. So this is basically what I'm replacing with my tube feed, right? Or my insurers or things like that. Okay. The big nutrition things that they're not getting. Okay. Simple enough. All right. Contraindications to this would be any allergies to the tube feed products, or any reason why it wouldn't be safe to give it to them through like the GI route. Okay. Interactions, we know that there's drug to food interactions, but really these aren't super crazy. They may decrease the effectiveness of antibiotics if you're taking like a tube feed with an antibiotic, or they may reduce the absorption of phenytoin. What kind of drug is phenytoin? Do we know?
Turn your pee on.
Just let's skip that. Just what does it do?
It's used for
Are we looking it up? Is that what I hear?
antibiotic treatment. Treatment. Mm,
Treatment of seizures.
yeah.
Treatment of seizures. Yeah. Okay. So if
Is
I'm
the
not
one you
getting
turn your
in my
on to?
um, I honestly don't know off the top of my head. It might. I'd have to look that up.
Um,
Sorry.
I might
But
got that wrong.
and that's okay. I honestly don't know. So you could be right. I have no idea. But Usually if it's reducing the absorption of a seizure drug and making a seizure drug not work very well, that's kind of scary if I have epilepsy, okay? So just keep that in mind with that, okay? My adverse effects here, all right? Usually with any type of tube feed, I have diarrhea. Who has seen PEG tube patients have diarrhea? I think that's like a dime a dozen, right? All right. They may have dumping syndrome, okay? Or they may have, whoop, I don't know what I did there. They may have dumping syndrome, or why do they have a high risk for aspiration or aspiration pneumonia?
Dumping syndrome.
Is it because they're laying flat when they're receiving it?
It could be.
Maybe.
Yep. Yep. Or if it's like a PEG tube or an NG tube, that tube may relax the stomach. So like those doors that keep the stomach closed really don't have to work anymore. So they're kind of like relaxed and the food may creep up. Okay. Sound good? Okay. So the first type of, enteral type formula we're going to do here is called elemental. All right. It's elemental. What this one does, all right, is it has formulas that have amino acids in it. So if it has amino acids, what am I replacing? Protein, yep. Okay. So elemental, enteral ones are just replacing protein. Okay. It's really all I need you to know. Okay. Here are some of the names. Okay. The most common name is probably going to be peptamin. So if you know that one, I think we're good. Okay. Sound good? All right. You shouldn't take this if you have GI problems, anything that's going to make you not absorb it. Okay. Otherwise, that is pretty much all I got with that one. Okay. Like I said, these are pretty short. Sorry, question? Okay. All right. The next one, the next that you digest through your GI tract is going to be polymeric. All right. That is going to contain all three macronutrients. So proteins, carbohydrates, and fats. Okay. So this one's going to give you everything. Okay. We're not picking and choosing what we're going to give you. We're just going to give you all three. Okay. So if you had a really malnourished patient, would this one be the most effective? Probably. Okay. So these are ones that are going to look the most familiar to you. Ensure, Osmolite, Longevity. Not familiar? We've given these to patients, right? And if you haven't, you will. Okay. Those are pretty much the names I need you to know. Ensure, Osmolite, and Longevity. Okay. Because those are going to be the main three. Okay. Basically, again, this is preferred because you're getting all three. All right. Otherwise, this is all I need you to know about this one. Okay. Okay. The next one is called modular. Okay. This one's a little bit different because it gives you three different options to get each of the macronutrients individually. Okay. So there's three different types. If you want to just get replacement of carbohydrates in this type of oral, supplementation of nutrients, it's going to be like you would take this one, the Polycose. All right. Does this make sense? Like how we're giving you options for one of the three. Okay. If you want to take just fats, okay, you could use macrolipid. Okay. Like my patient's low on fat, I'm going to give them this one. Okay. Or proteins, I could use ProSource or ProMod. Okay. However, these are intended to use in combos, so we can intermix them, okay, if we want to. Otherwise, that's all I need you to know for modular. Sound good? Any questions, concerns so far?
I
Okay.
have a question. So if you only want proteins, you can use ProSource or ProMod. If I wanted fat or carbohydrates, I could use either one of those, but I can also intermix them.
Yep. So example, like if I want carbohydrates, I would just use like Maducol or Polycos. But if I wanted like carbohydrates and proteins, I could give both of these together. Is
Okay.
that okay?
Yeah, that makes sense.
Okay, perfect. All right, and then the last enteral one, okay, is just simply glucerna. We've all heard of this one, right? Okay. If you haven't, you haven't been watching enough TV, okay? So these are usually given to who?
People with the renal.
That's the diabetic.
Yeah, these are usually given for people with
Oh, it's
diabetes.
renal.
Yes, not renal, but diabetes, okay?
Oh.
Says diabetes, okay? So this contains three macronutrients, so my proteins, carbs, and fats. All right, but it's also giving you these two electrolytes, sodium and potassium, okay? So it's giving you a little bit more vitamins and mineral type things that you don't get with the other ones, okay? And then it's also used for glucose tolerance, okay? Like when a when a diabetic patient takes like Levemir, right? It keeps their blood sugar stable all day long because it's a long-acting insulin, right? This is kind of similar. Like instead of eating like, I don't know, cereal for breakfast and you take a Glucerna, drink instead and you drink the whole thing, it'll work better to keep your blood sugar stabilized. Okay. Which is more beneficial for like a brittle diabetic who has their blood sugar fluctuating throughout the day very rapidly. Okay. Sound good? Okay. So those were my enterols. Okay, really quickly, I want to compare and contrast the difference between TPN and PPN. Have we heard of this? Okay,
Total parental nutrition.
exactly. So let me just do a compare and contrast thing here side by side. Okay, so TPN is, like we said, total parenteral nutrition. And then over here, I have PPN, which is what?
It's a parental.
Peripheral total.
Yeah, it's partial
nutrition.
parenteral nutrition. Okay. So we said parenteral means I'm giving it to you through an injection of some sort into the bloodstream. So both of these I'm giving through some type of IV. Okay, infusion. All right. So just kind of to tell you the difference between total and, oh my goodness, sorry, total and partial. Okay. When I take total, I am taking this because I deem that you are getting no outside food. Okay, you are not able to eat anything else. I am going to supplement all of your nutrition. Okay, does that make sense? Supplement everything. Okay. So because of that, these are higher in glucose content or my carbohydrates. Okay. What is bad about it being higher in glucose content? What is glucose? Is it thick? Is it thin?
It's big.
Yeah. Okay, glucose is very thick. So if I'm pushing that through a peripheral IV, just like your generic IV on the arm, okay, I'm going to blow a peripheral IV, okay? Why? Because it's so thick, it's gonna just rip right through it, okay? It's not big enough to support that. So you have to give these through a central line because that is able to tolerate the consistency of it. Does that make sense? Okay. Also, these ones are used for long-term use. Okay. Does anybody have questions about total? We good? Okay. So if I'm giving you partial, by the name partial, do you think I'm supplementing everything? No. Okay. We're assuming that they're eating some outside food. And by outside food, I mean real food. Okay. Like something orally. Okay. We're just going to supplement some things. Okay. Make sense? So because we don't have to supplement everything, this is not going to be high in glucose. So this one is not thick. So do I have to give this one through a central line? No, I can give this one through a regular peripheral IV. Okay. So this one is completely fine to go in your patient's regular IV. They don't need a specialized, central line up on the top. All right. Also, this is used short term. Okay. If I'm using a central line, what's the big thing that I need to watch out for?
Rabies.
Or infection.
Yeah, infection. Okay. We go with this. Any questions about the difference between TPN and PPN, total or partial? Okay. I'll give you a second if you want to I don't know if you want to take a picture of this or. Okay. Everyone, we good? Okay. I'm going to go back to the PowerPoint. Okay. All right. So that is summarized within this. I just wanted to clarify that and make it very easy to understand. Okay, but why would I give someone a injected type of nutrition versus a oral or an enteral?
Because it's
The
able to
oral,
go.
it's gonna go right to the main site.
They need it now.
Yeah, I need it quickly. Okay. Or usually there's something going on with the GI tract where it's not gonna use what I'm putting into it. Does that make sense? Like maybe I have some kind of malabsorption issue, like Crohn's disease or something, maybe stomach cancer, something like that, where if I put something into the stomach, it's not going to be able to use it. Okay. Questions about that? Okay. Otherwise, we're still supplementing all of the big three amino acids, carbohydrates, fats, and then we got some vitamins and minerals in there as well. Okay. Otherwise, we just talked about the difference between these, except peripheral. When I said it's used short term, again, I just want to clarify it's usually used for about 2 weeks. Okay. If you need it longer than that, you should be switched to a central line and be given TPN. Okay. Questions about that? All right. Otherwise, I don't care about this. These nursing implications, and I think we're done. All right. I need.
You said
Yes,
you
at
want
the
us
end.
to look over the nursing implications?
It's very echoey. I'm trying to understand what you.
You want us to look over the nursing implications?
Yes, I do. They're just simple things like monitor their daily weights, monitor their eyes and nose, keep track of their carb counts, monitor their blood sugar, just things like that. Okay. So just look over those. They're very self-explanatory. Okay. Make sure they're not allergic. Okay. We good?
Yes, you gonna upload the video tonight or tomorrow?
Probably tomorrow. Yep, because it's gonna take a while to load, so I'll do it when I get to work tomorrow. Okay.
Okay, thank you.
You're very welcome. Any other questions, concerns before we?
I do have a question. Are we testing over these chapters in the next week chapters, or are we? I know we got a HESI next week. Are we testing next week over this material?
No, yeah. So next week, yeah, I believe is a HESI, and then the whatever chapters we do next week, plus these 3 will be your next test. Okay.
Okay, thank you.
Yep. And then if you're confused too, it's in the syllabus too. We're in week 4, so if you want to look at the schedule, okay. All right. Any other questions, concerns before we log off here?
Which part of the syllabus you told us to look at?
I'm sorry, it's echoing again. Sorry, say that one more time.
Which part of the syllabus you told us to look at? to know which ones?
The schedule where it goes week by week and it tells you what chapters and what exams.
Okay.
Yep. Okay. This is week 4, so
All right. Thank you.
all right.
Thank you.
You're very welcome. If you need something, let me know, okay?